Everyone see?
Okay,
Okay.
now officially start the presentation. Thank you very much for stay with us. I'm Javier Ponce, and we this morning have the honor to present Heesun Choi. She's a medical doctor, emergency doctor, and he's a teacher, POCUS teacher, and he knows a lot about how we must teach POCUS. So I'm so glad to come to share this space with you. I give you the word and the place to talk, and no more for me.
Okay. Hola, me llamo Tara Choi. Perdón, un gusto conocerle. No hablo español y si necesito hablar, voy a hablar en English. So, my name is Heesun Choi. Nice to meet you, everyone. Good morning. I do not speak Espanol, so I'm going to speak English. So thank you so much for being here. It's very honored to present the POCUS escape room. So this escape room was created during the COVID-19 when we could not teach students and resident physicians in person. So I created this online escape room to teach them how to learn the pulmonary point of care ultrasound. So this is the website. So we're gonna just go through it and see if we can play the game while we are learning. If you have any question, please feel free to ask me question. And if you have anything, just type the question and we'll read it together. So this is how the escape room would look like, and I will send this link to my students or anyone who's learning. So they will have to start with the typing their email address, which I'm gonna put my own email address. When we do that, there is a question come out. So we're gonna do it together, okay? So you are enjoying your vacation after successfully graduating from an emergency medicine residency. You are treating yourself with a party cruise ship to release your stress. When you're about to hit the poolside, you hear an emergency announcement. Is there any available physician? Please come to the medical facility immediately. So I don't know if you can see how many people will help. Here I go again, save another life. Or now I'm on a vacation. Now that I'm unattending, I only work when I get paid. So if you guys can type, then I can see what you would like to type. See.
Go to the rescue.
Go to rescue. Okay, let's do that. Here I go. Let's save life. You arrive at the medical facility and introduce yourself as an emergency attending physician. A cruise doctor appears to be very confused and gives you a brief history. A patient is in systole, no pulse, cold, fixed and dilated pupils. But the patient is making incomprehensible sounds. Patient is not using a LVAC. I have never seen anything like this before. You evaluate the patient. Patient is cold to touch, fixed and dilated pupils, no pulse, no pulses yet. The patient is making strange sounds. Patient is also in a 4-point restraint. You want to confirm if patient is really in cardiac arrest and respiratory arrest. Which ultrasound probe would be the most appropriate for pulmonary scan? So there are two probes. One is curved linear, which is this one, and the other one is a linear probe. Which one would you use in the emergency to diagnose like something like a pneumothorax or pulmonary emergencies. So I'm gonna go answer because everyone is physician here. Let me see if I can see that. Okay, perfect. Curved linear. Should we go curved linear? Linear.
In in
Linear,
pediatrics,
okay. So let's go with the linear because it says linear. So curved linear, the big one, we use it for pneumonia or pleural effusion. Linear, we use it for pneumothorax. So this one was for the emergency and pneumothorax. Let's go with the linear. So when we use the ultrasound, what do you see now? I'm gonna play again. And that image, if I put something called M mode, this is what it shows. So is this pneumothorax with a seashore sign? Hemothorax with a barcode sign? Pneumothorax with a barcode sign? Or normal lung with a seashore sign? So
repeat the play, please.
very, very good. So it's a plural line and there is no movement. And when we put the M mode, it looks like this. Perfect. Someone said that pneumothorax. So yes, that's correct. It's a pneumothorax with a barcode sign. Do you guys see all the straight line here? So it's a pneumothorax with a barcode sign. So patient has a bilateral pneumothorax. Maybe this is why he's in acute respiratory arrest. Patient has no pulse, but his eyes are open, trying to bite everyone and very combative. What is going on? Trying to start CPR, but patient opens his eyes again, trying to bite. Are these new COVID-19 symptoms? You quickly place a probe in patient's chest, and what do you see on ultrasound? Play again. So that's a heart. Perfect. Someone said cardiac standstill. That is correct. There is no contractility, no cardiac movement. I'm going to play again. So that is correct. There is a heart is not beating. Thank you. So we're going to move to the next. So the cruise doctor says, take this personal protective equipment, portable ultrasound, and medical supply. I'm going to stay with you, but you should go find her. Here, take this. And the doctor gave you all this equipment. And the cruise doctor patient getting up, the cruise doctor saw the patient getting up from the table, trying to attack both of you. He drew the he says, run. If you were to choose to help, this might be a problem because you would not get out of the room on time. But because we decide to help people, we are getting out of the room. So let's go to next. So you ran outside, just entered any open room, you locked the door and tried on a powered air purified respirators. Maybe this could protect you from being bitten by zombies. As you're trying to figure out what's going on, you found an old lady sitting down, staring at you the whole time. You must be a doctor. I was trying to go to the medical facility, but I got too tired of walking. I forgot to bring my home medication and haven't taken it for 3 days. My legs are getting bigger. Can you help me? You have no stethoscope, but have the portable ultrasound. So this is the view with your ultrasound. Yes, perfect. A lot of beelines. Yes, presence of beelines more than three. Yes, a lot of beelines. That's correct. So let's go with the presence of more than three beelines. So now you're worried that the patient might be having pulmonary edema due to acute and chronic congestive heart failure. You perform cardiac ultrasound. What is your cardiac ultrasound finding? Very poor function, yes. So not a tamponade, decreased left ventricular ejection fraction that we can just look at it and by look at it, or decreased contractility, pulmonary embolism, cardiac standstill, dilated aortic outflow. We're gonna choose the decreased left ventricular ejection fraction. Perfect. You're now convinced the patient has an acute and chronic congestive heart failure causing pulmonary edema. You remember that she has not taken for medication for 3 days. Of course, she does not remember the name of her medicine. You look through her medical supply, which medication will benefit her most in this situation. Out of hospital, not on monitor, and end of the world. Perfect. Yes. Furosemide. By the way, a lot of students and a lot of residents, a lot of physicians in the United States pick ketamine. They said at the end of the world, they would just give ketamine. But we're gonna choose the right answer, furosemide. So you ask the lady if she can walk to find the safety. She says, I'm too tired to walk any further. You have given me my home medication and I think I'll be fine. Here, take this key. It's my gift. My husband used to be a captain of this cruise ship. This key will let you get into the main control room. There is an escape lifeboat you can access only through the control room. I have another key with me. Don't worry, go now. So you are running down the hall trying to find the control room when you are stopped by a mother with a child. She recognized that you are a medical provider wearing a pepper. She asks for help. She says, my daughter has been having fever, cough, and wheezing. I have given her an albuterol inhaler and Tylenol, but they didn't help. You decide to look at the child lung with ultrasound. What is your ultrasound finding? You know, may move up just a little bit. Perfect. Somebody said pneumonia. Yes, that's correct. You saw the consolidation right here. Perfect. You guys are so good. And air bronchogram. So pneumonia with a consolidation. And this is the hepatization of the lung when there is, yeah, perfect. Somebody said that like a liver. And you repeat point of care ultrasound lung on the patient and found an image. Patient mother asked, what is that? What is the sign of ultrasound finding called? Somebody already answered it. It's the lung hepatization. It looks like a liver. So I'm gonna answer that. So patient's mother is convinced that her child has pneumonia because she has pneumonia before. She's asking if you have any antibiotic to give the child. Based on ultrasound finding, you would agree this is likely pneumonia, which ultrasound finding favors diagnosis of pneumonia rather than atelectasis. So there is a finding that confirms or more likely to be pneumonia versus atelectasis. And that finding shows here. Yeah, perfect. Yeah, dynamic. The dynamic air bronchogram, that is what it would differentiate atelectasis from pneumonia. So look out, you hear someone screaming behind you. There is one middle-aged man who has fallen down the stairs and is unresponsive. You immediately evaluate the male patient, airway intact, breath sounds decreased bilateral, very faint pulse, and you found this. You performed the E-FAST on traumatic fall patient. What is your interpretation of the ultrasound scan? Positive E-FAST, yes. Positive right, yes, that is correct. So positive right upper quadrant, the positive E-FAST right upper quadrant, and positive free fluid in Morson's pouch. Is there Morson's pouch positive or positive with hemothorax? Let's go with positive right upper quadrant with hemothorax because Morson's pouch looked okay. Chemo, perfect. Patient's lung ultrasound also shows this finding. Which of the following condition has high specificity for pneumothorax on POCUS? So absence A line, B line present, lung pulse, A line present, B line present, bed sign, absence A line, absence B line, lung pulse present, A line present, absence B line, and lung points. Yes, somebody says last option. So having a B line, less likely to be pneumothorax, and having a lung points indicates more clear pneumothorax where the lung drops, the point where the lung drops. Perfect. Okay, patient has a hemothorax on the right and pneumothorax on left. You're looking through your medical supply, trying to find the material to do a thoracotomy. The patient with no breath sounds all of a sudden gets up and now trying to eat you. Run! So you finally arrive at the control room and door is locked. You see a few people inside about to get into the escape lifeboat. You show the captain key you received from the old lady. He looks at you and says, I can only let you in if you prove that you don't have COVID-19. You pulled previous recorded COVID-19 patients' POCUS lung clip. You're trying to compare the patient's lung scan with your own lung scan to explain to the captain why you don't have COVID-19. Which of the ultrasound findings that are consistent with COVID-19 pneumonia? And this video is the COVID-19 pneumonia that we diagnosed during the COVID. Yes, subpleural consolidation because the viral pneumonia likes to be in a pleural line, and we see the subpleural consolidation right there. And the captain is convinced that you don't have COVID-19, and since you have the key and wearing pepper, he let you in. Woohoo! Hell yeah! So that would be the end of POCUS escape room, and this is the how I would teach resident and medical student or any other physician how to learn point of care ultrasound, which go over pneumothorax, hemothorax, positive effects, pleural effusion, and pneumonia and all that. It was because everyone is so good. It ended pretty quickly. Do you guys have any question or anything that you want me to go over?
Thank you so much. It's so funny. So, congratulations. Very good job. I have a question to you, and I invite to the people to talk. Is David, Lelis, how you designed escape room? What point or do you did you do this presential, for example, not virtual, with your pupils, with your residents?
Yes, I can show you how I did it. Let me share my screen. So I use something called Google Form. Let me show you. Mm, okay, so let me share you Google Form here. So if you have a Google, you can go to Google, something called Google Form. It looks like purple like this. And I made a different section. So each section, you can make this, choose a question, put a picture, and you can set after season 2, continue to next session, but you can pick here, let me show you. You can duplicate section, move section, delete section, or you can give them order. So let's say here, if somebody pick nah, I'm on vacation, then you go to section 15, or here I go again, save date, then you go to section 5. And my section 5 would be the next question right here. And section 15 that we didn't see because we didn't choose the answer. So section 15 would be going into, you got into a vacation, you were partying, you got your foot injured, and then you end up going to the question. So this whole Google form is a prompt to make you go to right answer. If you get a wrong answer, then it will say, let's do this again and go back to the session. And I created this because during the COVID, it was very frustrating to show and teach them interacted because a lot of Zoom meetings during COVID for 2 years, and just teaching lectures through the Zoom was not fun enough. And I had to create something very interactive with any learners to be engaged, because it was very difficult for me to be on a Zoom meeting for 6 hours a day or 8 hours a day.
We have a question from David. Which ultrasound protocols have best responded to learning in escape rooms?
So I have created all different escape room. Like this one was a long point of care ultrasound, but I have other story for like trauma POCUS and another one for like abdominal injury. So I think doesn't matter what kind of protocol it's, as long as your story is fun and you have your objective and different picture and all learning point, I think it would work for any protocol.
Excellent. Have you experienced doing it presential, not virtual, in an escape room in land? Did you make this?
Yeah, I created this. It took me a very while to create this. All the videos in this escape room was actually from my patient or the patient from UC Biomedical Center. And all the storyline, as you can see, some of my grammar is terrible because English is not my first language. So English was not good. So I made all the question and I made a scenario, and you can see I love zombie movies. So that's how it got created.
Thank you. This should be a must in teaching POCUS. Congratulations. We are always thinking how improve the POCUS education, and the game improves, or unless we have fun while we are we are teaching and we are doing this course. Thank you so much. So, any one question? In I'm going to talk a little bit in Spanish for the audience. ¿Alguna pregunta en el auditorio? Ya le pedí disculpas a nuestra invitada por mi pésimo inglés, my bad English. My English is so bad, it's so. But, ¿en alguna pregunta entre los presentes? David.
Hello, everyone. I just have congratulations to Heesun Choi for this amazing work and amazing part of the teaching and learning focus. So this amazing. We in USPED, we need to apply this to all of our students. So I have so fun with this. So thank you, Heesun Choi.
Thank you so much. I wish I speak Spanish much better. Muchas gracias.
Okay. Thank you, Heesun. I am very happy, and I again thanks you for time and to share this your experience with us. Thank you very much. And a final words, and we say goodbye. If you want to say something.
Thank you so much. I really appreciate it. And this is a really honor. And I always had a dream of teaching more point of care ultrasound to South America and Spanish speaking community. I went to Peru and Amazon jungle with portable ultrasound and scanned the little villages over there. So it was one of my dreams and missions. So thank you very much for inviting me. And I'll be happy to come back at any time whenever you guys need. Thank you so much.
I take your word to 2025. I send you email to keep talking about POCUS and teaching POCUS. Thank you so much, and see you next Saturday. Good Saturday for everyone. Goodbye. Thank you.